Hello everyone, welcome back to my YouTube channel. As I explained in my previous daily vlog regarding a case of frozen shoulder, I am here today to share more details about it. In this video, I have explained the case in detail, discussed the Spencer technique and the related studies, and I will give explanation how to perform the Spencer technique step by step. This case involves a 52-year-old female who had been experiencing shoulder pain for the past 5 months. Initially, she neglected her condition and was not very concerned about the pain. As time went, she began to experience functional difficulties. She was unable to perform overhead activities and had trouble with tasks such as combing her hair, reaching behind her back while bathing, and buttoning her blouse. When I took her medical history, I found that she has type 2 diabetes. On palpation, there was a tenderness over the acromoclavicular joint and the pectoris muscle tightness. During the examination, capsular pattern were noted. There was a function restriction in lateral rotation, medial rotation, abduction and flexion. Sensation was not affected. Based on these findings, I diagnosed it as a case of frozen shoulder. In addition to other physiotherapy treatments, I incorporated the Spencer technique. I will now explain the Spencer technique in detail. Before that, let me share a few studies that supports its effectiveness. And the study which was done in 2020, which concluded that Spencer technique was more effective than passive stretching in treating patients with adhesive capsulitis. And the study from 2025, which concluded that both Maitland mobilization and Spencer muscle energy techniques effectively reduce pain, improve range of motion, and enhance the functional capacity in patients with frozen shoulder. However, the combined treatment was found to be more effective than Maitland mobilization alone, and this suggested that there is integrated both techniques into clinical practice may enhance treatment outcomes. Then in the study which is 2025, which has concluded that Spencer muscle energy technique was more effective than conventional physiotherapy in treating pain and functional impairment associated with the adhesive capsulitis. Now let's begin with the explanation of the Spencer technique and how to perform it. There are 7 steps involved. Step 1. Shoulder extension with elbow flexion. The patient's elbow was maintained in a flexed position and the arm was extended until the restricted barrier. Step 2. Shoulder flexion with elbow extension. The patient's flexed elbow was extended and moved anteriorly into shoulder flexion until the restricted barrier. Step 3. Circumduction with compression. Grasp the patient elbow with the shoulder in 90 degree of abduction and move the elbow in a small clockwise and anti-clockwise circle with compressive force. Step 4. Circumduction with distraction. The therapist maintained the traction of the patient's shoulder joint in 90 degree of abduction and held either elbow or wrist induced small clockwise and counterclockwise circle. Step 5. Shoulder abduction and internal rotation with elbow flexion. The patient was asked to place his hand on the therapist's forearm for support, and then the therapist performed abduction and internal rotation of the patient's arm. Internal rotation 90 degree. The therapist placed the dorsum of the patient's hand behind his or her hip and moved the patient's elbow anteriorly. Step 6. Shoulder abduction and external rotation with elbow flexion. The patient was asked to place his hand on the therapist's forearm for support, and then the therapist took the patient's arm into adduction and external rotation. And final step is step 7. Stretching tissue, pumping fluids with the arm extended. The therapist interlocked his fingertips over the deltoid muscle. The patient's hand was placed over the therapist's shoulder and the therapist slowly moved the arm away from the shoulder and release. Repeated for 5 to 10 minutes. Well, I hope you understand so far, but it's important to note that we cannot conclude that the Spencer muscle energy technique is consistently superior to other manual therapies. Here, one more article comparison of the effectiveness of Mulligan mobilization and Spencer technique and conventional therapy for frozen shoulder. The conclusion of the study was that all three exercise groups showed improvement in pain reduction and disability. Among these three, patients in a group A who received Mulligan mobilization showed the best results in terms of pain reduction, improved function compared to group B and group C who received the Spencer technique and conventional therapy respectively. Based on this, the study recommended Mulligan's mobilization as a highly effective treatment for frozen shoulder. I hope you found this video helpful. Thank you for watching. Please like, share, and if you have not subscribed yet, make sure to subscribe for more content like this.